Okay, we haven't done a case study for a while, so let's go over case study. And this one's gonna have a little bit of a twist. So make sure you stay until the end because there might be a little bit of a surprise that you didn't see coming. So a patient is a 12-year-old athlete, soccer player, lives about an hour and a half away, has been having problems, and her dad is reporting that she stands weird, her posture is off, that she looks like something is off, and her dad kind of sort of thinks of himself as maybe like a strength coach, speed coach type guy, and he's worried about posture and biomechanics. And he's worried about future injuries. So she's really not having any complaint of acute pain. She's not having any kind of a like chronic, like day after pain after competition or practice or anything like that. But he wants to head things off before she gets there, which is a fantastic idea. So have her come in, and as we went through in the filling in the holes, what PT school didn't teach you webinar, and what we've done in pretty much all of our webinars, is go through how we are going to go through this assessment or this evaluation. So first, have her take off her shoes. Actually, first, talk to her, got her subjective. She really doesn't notice anything different. Feels like she's playing pretty well. Feels like at the end of games, she's getting tired, maybe a little bit tight, that kind of stuff, but no real acute pain. No swelling after a competition or anything like that. So have her take her shoes off, watch her walk, and she definitely has a unique gait and stance. So let me try to mimic what she looks like. So if we go, so internally rotated, man, gotta get even further. See if I can get my feet on the screen here. So internally rotated stance like so, internally rotated gait like this, a little bit of a circumduction swing when she walks, and when she stands like so. So when I have her do a squat, and I said, okay, do a squat, and she has done some strength and conditioning stuff in the gym with her dad before. So I said, okay, so show me what it looks like when you do a squat. So she widens her stance a little bit. She keeps her feet straight ahead now, and she squats down, gets all the way down to ass to grass, no problem. Have her stand on one foot and do single leg squats, and she's a little bit unstable. Trunk rotation, she's normal, no problems. Toe touch, she gets all the way down to palms flat, no problem there. Lumbar extension, no problem there. Heel toe walk looks good. Upper body screen, cervical screen, all that stuff looks good. So the only thing we're taking away from her functional screen is internal rotation at the hips, which we know is pronation. So internal rotation of the hips also feeds into adduction at the knee when she's walking, a little bit of a circumduction when she goes through her gait. Stance is internally rotated, but if I have her do a squat, she comes out to feet straight and ass to grass, no problems. So, an unstable single leg stance. So she presents like a typical 12-year-old girl who tends to go towards hypermobility. Okay, so that's about all we get there. So as we're doing this, her dad is pointing out how she's internally rotated, and he's worried about this internal rotation, and he's been trying to correct this with exercises and stretching. So put her on the table, start going through things, and she's really good at the majority of what I'm testing. So a little bit of glute med, a little glute max, all of her foot stuff, perineals, tib anterior, tib posterior, abductor hallucus, toe flexion extensors, all good. Not a lot going on there. Pyramidalis need a little bit of work. Transverse abdominis need a little bit of work. Nothing really upper body. So it only takes me about 10 minutes to go to go through everything with her on the table, big toe to occiput, and there's not really anything remarkable going on there. So get her off the table, redo the screen, relatively the same, better single leg stance stability. She still likes to be internally rotated, adducted at the knees. So I said, well, let's do this. Let's take her in the gym and actually look and see what she looks like when she's doing athletic movements. So take her in the gym, showed her lunge walk, showed her crossover walk with a squat, do a little high knees, do a little butt kick, do a little karaoke, all of that stuff. Guess what? She externally rotates and looks quote unquote textbook normal. So she takes herself out of internal rotation when she's doing fast, quick athletic movement. So have her do side to side cutting, have her do jumping, hopping. Everything looks like she would have normal gait. So here's the twist, and here's what I told her dad. There's nothing wrong with her. Quit worrying about her posture. That's the way she is. She's 12 years old. Her body is still figuring things out. She's still growing. You're not going to correct her posture. There's nothing wrong with it. It's not pathological. It is not causing her any problems. She has no pain, either acute or chronic. When you have her do athletic movements, she looks completely normal. Normal stability, single leg cutting back and forth, good stability. I am not worried one bit about her becoming injured except for one thing. And that is her dad telling her that she needs to stretch and foam roll and have better posture. Forget about posture, especially in prepubescent or teenage athletes who are going through puberty. Forget about it. They're going to break the rules. They're going to do what they need to do to be successful, and that's exactly what she's doing. So there is nothing wrong with her. What I told her is stop stretching. Do not ever stretch again for any reason. Don't worry about your mechanics. Now, I did tell her, like, when you're doing resisted squats, if you want to do a narrow leg squat, a narrow stance squat, and keep your feet straight, fine, fantastic, no problem. I would also recommend you do a normal stance squat. So we played around with stance with her squats and figured out that slightly externally rotated is the best for her with her bony morphology and her genetics and her biomechanics. So that's what she needs to be doing. And if her circumduction goes away, and if her internal rotation during stance goes away, fantastic. I bet that it will as she gets stronger and her body catches up with itself as she's going through her growing phase of puberty. So basically what I told her dad is, thanks for driving an hour and a half. Hopefully this shines some light on your daughter being totally fine, and you need to calm down and just let her body do what it wants to do. Keep on doing your strength training. Keep on going to practice. So she's practicing with her club team right now 3 days a week and has games on Saturday. She's doing her strength training stuff 2 days a week on her off days from practice. Totally fine, fantastic. Told her dad, make sure when you're doing her strength training that she's going through a full range of motion, that you are incorporating aplanar motion, transverse plane motion, which she's getting a ton of when she's at practice. So just incorporate those movement patterns and those mechanics into her resisted training as you're doing those things with her, but do not try to correct her. Don't give her verbal cues when she's running. Don't give her verbal cues when she's standing. Don't give her verbal cues when she's walking. Do not put inserts in her shoes, because that will help her externally rotate and keep her knees from falling in. Stop it. Her body will correct this and move on as she goes and gets older, bigger, faster, stronger, and everything will be fine. So just because somebody doesn't look like the textbook, especially if they're going through puberty, their body is confused as hell. It's just trying to keep up with growth. It's just trying to get through the puberty phases. Don't try to correct them. Don't put them in braces. Don't put them in tape. Don't put them in orthotics. Let their body do what their body wants to do, unless there's something wrong. So if she came in and said, I have an acute knee pain when I do this, then I would say, okay, there's something off here. We need to go through and figure out what that is. When she comes in and says, I have no acute pain, I have no chronic pain, the only thing I have a problem with is at the end of a 4-hour practice or at the end of a weekend where I played 2 back-to-back games, I feel fatigued. Fantastic. You should. Just keep training. Okay? So don't freak out. Don't try to correct things. If people present in their functional screen with normal strength, normal range of motion, normal stability, no pain, no limitations, put that in your memory bank. Start going through, breaking them down on the table, muscle by muscle. If you're only on the table working on 5 muscles over 10 minutes, there's not a lot going on here. Those 5 muscles could have been fatigued from the previous day's practice or the previous weekend's games. Don't freak out. Let the individual dictate what you do and where you go. Don't hold them up to normal standards. All right. So hopefully that helped you out. If you have questions, post them below.